Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy or you're just tired of not feeling like yourself, this space is for you. The hypervigilance that comes with being either a food allergy patient or a parent of a food allergy patient really feels like a full-time job. That food becomes fear instead of fuel. Today, we're going to talk about that emotional and mental load that you know all too well. But more importantly, we're going to talk about the fact that this burden doesn't have to be something that you carry forever. Let's get it. Let's get right into it. As a parent, as a person with food allergy, I've seen the constant scanning, planning, pre-planning, backup planning for that fear of the accidental exposure, that fear of that potentially life-threatening reaction. All the things that go into it, whether it's your child that you're scared as they're going to now be leaving. Perhaps maybe they were younger and now they're heading into like kindergarten age and they're not going to be in your sight. You're not going to know what's being fed to them. Or they're going to a friend's house or to the movies or to camp or on an airplane. All of the what ifs that you have to plan for with this hypervigilance of a full-time job to keep your child safe just carries a load and can be absolutely exhausting. It is like you have this mental spreadsheet that's always running, that's always computing the data. And it's just draining, right? So often what you'll have to do is skip events, eat separately, feel like, the difficult one or the odd one out. Sometimes you may even be blamed by other people, whether it's family members or friends or people on airplanes that are, maybe overreacting to your hypervigilance because they're not giving the proper due diligence to you, validating your concerns enough. And for parents, they may often feel a lot of guilt about their vigilance or being on call all the time and all the invisible work that goes on in packing safe foods, advocating at school, reading the labels, vetting the restaurants, talking to the airlines, talking to the hotels. Does it have a kitchen? Packing the safe foods, teaching your kids to self-advocate without passing on the fear. But sometimes it's really hard. It's really hard to have to be that person all the time without passing on that fear. And then that fear adds to the fire. And again, that fear becomes the fuel, not the food. And it can be an absolute emotional toll and an emotional load. It's often anxiety disguised as preparedness. The fatigue of always being on the watchtower. Your identity gets entangled with limitation, with phrases like, oh, I'm allergic, becomes, you know, uh, some seemingly like, I'm fragile, which you're really not. I'm not saying that's what you are. I'm just saying like that's often how it may be perceived by others. So how do we handle this? I mean, how do we handle this? First of all, I don't want you to blame yourself. I don't want you to feel guilt. I don't want you to think about all the what ifs of perhaps what you could have done prior to or what you're doing now. Rather, what we want to do is educate. We want to empower. We want to be prepared more than scared. We want to make a turn of all, instead of being limited and all the can'ts in the life, to what you can do and what choices are in front of you. That because the world of allergy care has really shifted. It really has shifted. We are past a tipping point in terms of where we're at in allergy care. There are real research supported treatment options that can reduce your risk. We can widen safety margins. We can restore ease, and we can move towards normalcy. And it is awesome. It is so awesome. We can start little by little removing that load, the emotional and mental load that you've been carrying. Now, not every treatment is for every person, but there's choices. And part of my mission in this life is to bring you choice, to bring you options, to not only educate you, but also educate your providers. If they're uncomfortable doing it, have them reach out to me. I would love to be able to empower those who are treating you. So that my goal is that every person has a choice. Right now, in my clinic, we can offer a whole menu of treatment options that, in my opinion, give a lot of empowerment. And these treatment options are individualized, they're personalized. It is not necessarily one size fits all. We try to find the size that fits the one. And as we do this, we join together as a team and we're able to work towards that sense of normalcy. Those options include things that you've heard me talk about before, like oral immunotherapy or sublingual immunotherapy. Now, both of these types of therapy actually change your immune system. They will change your immune system to make that person less allergic. It will raise the threshold by which they react to a food, and it can, first of all, enhance the safety margins, reduce your risk. And in the case of oral immunotherapy, most of the patients are going to be able to eat those foods that were once threatening their life without avoidance, that they can live more freely and have that sense of normalcy. As people go through this process, it's quite empowering. It's really empowering to see the change and the shift that happens when they see what they can do. These are treatment options that can use regular food, just regular food. You don't actually need a pharmaceutical product. You don't need anything that's actually anything other than food. We can actually achieve this with good quality food. And it also speaks to the power of the microscopic amount of food. That in certain circumstances, that microscopic amount of food could threaten your life. But when we use that correctly in the right timing, in the right dosing, in the right intervals, under the proper care of somebody that is educated and trained in the expertise and nuance of food allergy treatment, guess what? We can change your whole dynamic. We can change the whole outlook. We can transform your immune system to where it's now recognizing this food as danger, to where now we can get in and that food can now serve as your protector. It's truly an amazing process. We also, if you choose, can utilize certain pharmaceutical products called biologics to reduce the allergen, the reactivity, raise your threshold of reaction, and we can utilize those products alongside oral immunotherapy or even on their own to even control some of the um, underlying factors that may even prohibit you from doing oral immunotherapy. You know, a lot of times people will say, well, I have a condition called eosinophilic esophagitis or EOE. If you don't know what that is, it's okay. It's just, it is actually kind of a chronic inflammation of your throat, usually triggered by allergies. And a lot of people think that is an absolute contraindication to doing food allergy therapy, but that's not the case. We can actually do food allergy therapy in patients with that disorder, but we can do it by itself, or we can utilize biologic therapy or medications to help control that EOE while we're doing food allergy therapy. So there's a lot of nuance to which treatment may be best for you. Again, I don't practice a one size fits all. And a lot of your doctors, especially those that work with like my nonprofit organization that I'm associated with, the Food Allergy Support Team, you can go to their website at fastoit.org. Um, there's a map of a lot of allergists in the country that are offering really great treatments. And we get together once a year and have a day and a half workshop where we collaborate and we establish best practices of food allergy diagnostics um, and also treatments. And so there's a lot of resources out there, and I am very anxiously engaged in finding ways that we can bring care to you, whether it's through your allergist or through the use of technology. We've been able to find ways that we can also deliver our care through telemedicine, through telehealth. We can utilize that technology that's right there at our fingertips to bring care to you. So people that are maybe in a rural part of the United States, for instance, that may not have access to care, now have access to care. We're creating ways that we can do things. Again, I don't want to focus on the can'ts. If there's a can't, well, let's define that problem, let's define that challenge, and let's offer some solutions. Let's offer a way through. It's not that the obstacle is in the way, the obstacle is the way. It is the way through. And what I want to do is partner with patients. I want to partner with doctors, with professionals that are interested in elevating and bringing care to you, because I will tell you, seeing patients go through this process of once carrying a tremendous emotional and mental load, and then going through the process of having that lifted, and also going through that process of having them be able to eat the things that they want to eat and establish a sense of normalcy in life, has been one of the most rewarding things I've ever seen and done. Let me tell you a story. Years ago, there was a patient of mine, 8 years old, um, highly allergic, like all our patients are. When he would come into clinic, there would not be any eye contact. He wouldn't speak to me. He was so shy. He was so reserved that I could not even get eye contact. That little boy, though, was amazing because even though he was that, he put trust in his parents, he put trust in me, and he trusted the process. As we started working through the therapy, as the weeks and the months went on, I started noticing a change in this little boy. All of a sudden, instead of having his hat pulled down over his eyes and looking at the floor, now all of a sudden he was looking at me. He was engaging with me. He was drawing pictures for me. Now all of a sudden, as the weeks and months go on, we're talking with each other. We're laughing, we're joking. And towards the end of his program, it was kind of around Halloween time, actually. And he was dressed up as a fireman, and he said, I want to be a fireman when I grow up. And interestingly, his mom shared that she's like, I had never heard him talk about what he wanted to be when he grew up. He'd never had that dream of what he wanted to be when he grew up. And she actually asked him about it. And she said, you've never mentioned this before. You've never talked about what you wanted to be when you grow up. And this little boy said, I never thought I would live that long. It was an 8-year-old. It was an 8-year-old boy carrying that mental, emotional, and physical burden. But through the course of treatment, realized that could be lifted. things could change. He now could dream. He now could do those things. He had the confidence. He was empowered through the process to be able to do those things. Instead of the can'ts, let's focus on the can. Of what can we do? There's an obstacle in the way. Okay, let's define it. Let's figure out a way around it. Let's do this together. If you're carrying the weight, again, this type of treatment is so much more than just about the food. It's about the psychosocial aspects of life. It's about feeling included. It's about having confidence within you. It's about choice. We want to give choice. So if you want to explore which treatment options may fit your life, your family, your nervous system, I talk a lot about this. Reach out. Even if you don't want me to necessarily be your doctor, you can reach out through my website, drdugjones.com, and we can talk about how I can speak at your community. I can speak at your live event. I can go into any of these topics in more depth. If I'm licensed in your state, which I'm licensed in a lot of states due to telehealth, reach out. Happy to see if we can establish care in that way. If you want to continue to work with your doctor, but they haven't yet quite embraced treatment options, put them in touch with me. I'd love to get them in part of our nonprofit organization, the Food Allergy Support Team, again at fastoyt.org, so that we can better reach out to them and include them in our discussions and help them feel confident and empowered in offering treatments to you. The point isn't to push you into any kind of treatment or to push you in any direction. The point is to give you choice. The point is to provide opportunity, to create ways that we can have greater outreach. So for our immune edit for this week, first let's acknowledge the emotional, mental, and physical load that food allergy presents. But let's edit that with opportunity, with choice, with a menu of options that hopefully we can bring to you. And hopefully you can enjoy and feel that sense of normalcy. And just like that 8-year-old boy I told you about, you can start dreaming. You can start imagining life, of what life may be like. Imagine what your life may be like without that load. That's your edit today. Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.